It's Mark back, Mark the dentist, Mark the dental shaman with number 7 of my mini series. And what's the next test that I've got up my sleeve? And it is, how should we call it? So it's number 7. And we're going to call it swallow movement or no movement. What actually moves when your lips are together with a mouthful of saliva and when you swallow. And in the ideal world, it's just the Adam's apple, if you have one, or just the throat area that just bobs up and down as you swallow. So I'm just acquiring some saliva. Here we go. This is my personal swallow. And did you notice there was negligible movement of my facial muscles? So when I've checked this for many years on many patients, I see these kind of movements, from squinting and closing of eyes, squeezing of cheeks, squeezing of lips, frowning, engaging all these facial activity muscles to help with that squish down of saliva. And that is so challenging, just to say the least. It's so upside down, and it's not how we're designed. And you can imagine all the energy that we're using every time we're swallowing if we have to power down on all those muscles. So I need to know, or a dentist will need to know, if that is happening. And just as importantly, what's happening to your strongest muscle in your body, the tongue. What's happening to that when you swallow? Is it staying, just pressing gently up against the roof of your mouth, in the palate? Or is it just sitting softly in the floor of your mouth? Or is it thrusting sideways? Or is it thrusting outwardly as you swallow? Again, critical information that most dentists will ask for, especially orthodontists, because if a tongue is doing this when you swallow, it's going to ruin all that lovely orthodontic work as soon as the treatment gets stopped. So these are myofunctional checks that are part of my number 7. So we're just going to call it myofunctional checks. Okay, so that's number 7. I'll see you tomorrow for number 8.